Hey Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 100 Practice NCLEX questions. Without the way, let's get started.
A client who underwent a left lower lobectomy has been out of surgery for 48 hours. The client is receiving morphine sulfate via a patient-controlled analgesia system and reports having pain in the left thorax that worsens when coughing. The nurse should 1. Let the client rest so that the client is not stimulated to cough. 2. Encourage the client to take deep breaths to help control the pain. 3. Check that the PCA device is functioning properly, and then reassure the client that the machine is working and will relieve the pain. 4. Obtain a more detailed assessment of the client's pain using a pain scale. The correct answer is 4. Systematic pain assessment is necessary for adequate pain management in the postoperative client. Guidelines from a variety of healthcare agencies and nursing groups recommend that institutions adopt a pain assessment scale to assist in facilitating pain management. Even though the client is receiving morphine sulfate by PCA, assessment is needed if she is experiencing pain. The concern is not to eliminate coughing, but to control pain adequately. Coughing is necessary to prevent postoperative atelectasis and pneumonia. Breathing exercises may help control pain in some circumstances. However, most clients with thoracic surgery require parenteral opioid analgesics in the early postoperative period. Although it is necessary that the PCA device be checked periodically to ensure that it is functioning properly, if the machine is functional and the client's pain is not relieved, further intervention, beginning with a pain assessment, is indicated. While assessing a thoracotomy incisional area from which a chest tube exits, the nurse feels a crackling sensation under the fingertips along the entire incision. Which of the following should be the nurse's first action? 1. Lower the head of the bed and call the physician. 2. Prepare an aspiration tray. 3. Mark the area with a skin pencil at the outer periphery of the crackling. 4. Turn off the suction of the chest drainage system. The correct answer is 3. This crackling sensation is subcutaneous emphysema. Subcutaneous emphysema is not an unusual finding and is not dangerous if confined, and the nurse should mark the area to detect if the area is expanding. Progression can be serious, especially if the neck is involved. A tracheotomy may be needed at that point. If emphysema progresses noticeably in 1 hour, the physician should be notified. Lowering the head of the bed will not arrest the progress or provide any further information. A tracheotomy tray would be useful if subcutaneous emphysema progresses to the neck. Subcutaneous emphysema may progress if the chest drainage system does not adequately remove air and fluid. Therefore, the system should not be turned off. The nurse observes a constant gentle bubbling in the water seal column of a water seal chest drainage system. The nurse should 1. Continue monitoring as usual. This is expected. 2. Check the connectors between the chest and drainage tubes and where the drainage tube enters the collection bottle. 3. Decrease the suction to negative 15 centimeters H2O and continue observing the system for changes in bubbling during the next several hours. 4. Drain half of the water from the water seal chamber. The correct answer is 2. There should never be constant bubbling in the water seal bottle. Normally, the bubbling is intermittent. Constant bubbling in the water seal bottle indicates an air leak, which means that less negative pressure is being exerted on the pleural space. Decreasing the suction or draining part of the water in the water seal chamber will not reduce the leak. A nurse is to administer 10 milligrams of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 15 milligrams per milliliter. How many milliliters should the nurse administer? Round to 1 decimal point. Blank ml. The correct answer is 0.7 milliliters. The formula is 10 milligrams over X ml multiplied by 15 milligrams over 1 milliliter. You cross multiply, and you get 15x equal to 10. You divide by 15 on both sides. X equal to 0.666, and then you round to 0.7 milliliters. For a client with rib fractures and a pneumothorax, the physician prescribes morphine sulfate, 1 to 2 milligrams per hour, given IV as needed for pain. The nursing care goal is to provide adequate pain control so that the client can breathe effectively. Which of the following outcomes would indicate successful achievement of this goal? 1. Pain rating of 0 on a scale of 0 to 10 by the client. 2. Decreased client anxiety. 3. Respiratory rate of 26 breaths per minute. 4. PaO2 of 70. The correct answer is 1. If the client reports no pain, then the objective of adequate pain relief has been met. Decreased anxiety is not related only to pain control. It could also be related to other factors. A respiratory rate of 26 breaths per minute is not within normal limits, nor is the PaO2 of 70, but these values are not measures of pain relief. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client is undergoing a thoracentesis. The nurse should monitor the client during and immediately after the procedure for which of the following? Select all that apply. 1. Pneumothorax. 2. Subcutaneous emphysema. 3. Tension pneumothorax. 4. Pulmonary edema. 5. Infection. The correct answers are 1, 2, 3, 4. Following a thoracentesis, the nurse should assess the client for possible complications of procedure, such as pneumothorax, tension pneumothorax, and subcutaneous emphysema, which can occur because of the needle entering the chest cavity. Pulmonary edema could occur if a large volume was aspirated, causing a significant mediastinal shift. Although infection is a possible complication, signs of infection will not be evident immediately after the procedure. Which of the following is the highest risk for a child with leukemia whose lab values are as follows? WBC 6,500, platelet count 40,000 microliter, and HCT 41.2%. 1. Activity intolerance. 2. Bleeding. 3. Impaired tissue perfusion. 4. Infection. The correct answer is 2. A normal platelet count is 150,000 to 400,000 microliter. A platelet count of 40,000 microliter is low and puts the child at risk for injury, bruising, and bleeding. Hematocrit of 41.2% is normal. Therefore, the child will have adequate oxygenation and tissue perfusion. 6,500 is a normal white count. Therefore, the child has no increase in risk for infection. The nurse and parents are planning for the discharge of a child with leukemia who is receiving dactinomycin and vincristine. The nurse should teach the parents to 1. Encourage increased fluid intake. 2. Keep the child out of the sun. 3. Monitor the child's heart rate. 4. Observe the child for drowsiness. The correct answer is 1. Dactinomycin and vincristine both cause nausea and vomiting. Oral fluids are encouraged, and antiemetics are given to prevent dehydration. Avoiding sun exposure is not necessary because photosensitivity is not associated with these drugs. Heart rate changes and drowsiness also are not associated with either of these two drugs. A transfusion of packed red blood cells has been prescribed for a 1-year-old with sickle cell anemia. The infant has a 25-gauge IV infusing dextrose with sodium and potassium. Using the situation, background, assessment, recommendation method of communication, the nurse contacts the primary healthcare provider and recommends 1. Starting a second IV with a 22-gauge catheter to infuse normal saline with the blood. 2. Using the existing IV, but changing the fluids to normal saline for the transfusion. 3. Replacing the IV with a 22-gauge catheter to infuse the prescribed fluids. 4. Starting a second IV with a 25-gauge catheter to infuse normal saline with the transfusion. The correct answer is 2. The best evidence indicates that a catheter as small as 27 gauge may safely be used for transfusion in children, but blood must be infused with normal saline, not dextrose. A 1-year-old should be able to maintain their blood glucose for the 2-hour duration of the infusion without the need for a second IV. After instruction of a prima gravida client at 8 weeks gestation about measures to overcome early morning nausea and vomiting, which of the following client statements indicates the need for additional teaching? 1. I'll eat dry crackers or toast before rising in the morning. 2. I'll drink adequate fluids separate from my meals or snacks. 3. I'll eat 2 large meals daily with frequent protein snacks. 4. I'll snack on a small amount of carbohydrates throughout the day. The correct answer is 3. The client needs further instructions when she says she should eat 2 meals a day with frequent protein snacks to decrease nausea and vomiting. The client should eat more frequent, smaller meals with frequent carbohydrate snacks to decrease nausea and vomiting. Eating dry crackers or toast before arising, consuming fluids separately from meals, and avoiding greasy or spicy foods may also help to decrease nausea and vomiting. A client at 15 weeks gestation is admitted with dark brown vaginal bleeding and continuous nausea and vomiting. Her blood pressure is 142/98 and fundal height is 19 centimeters. The nurse should prepare to do which of the following? 1. Transfer the client to the antenatal unit. 2. Keep the client NPO for 24 hours. 3. Administer magnesium sulfate. 4. Obtain an ultrasound. The correct answer is 4. The nurse should prepare the client for an ultrasound to determine the cause of the symptoms. Elevated blood pressure at this point in the pregnancy could indicate chronic hypertension, as well as hydatidiform mole. The fundal height of 19 centimeters is higher than is typically found at 15 weeks gestation and is indicative of a molar pregnancy. The dark brown vaginal bleeding in isolation could indicate an abortion, but when placed in context of the other symptoms, is likely related to a hydatidiform mole. The continuous nausea and vomiting is abnormal at this point in the pregnancy and can be a result of high levels of progesterone from a molar pregnancy. There is no fetus involved. The blood pressure elevation and continuous nausea and vomiting will resolve with evacuation of the mole, negating the need for magnesium sulfate therapy and placing the client on NPO status. The nurse is caring for a prima gravida client in active labor at 42 weeks gestation. The client has had no analgesia or anesthesia and has been pushing for 2 hours. The nurse can be most helpful to this client by 1. Changing her pushing position every 15 minutes. 2. Notifying a healthcare provider of her current status. 3. Continuing with current pushing technique. 4. Assessing the client's current pain and fetal status. The correct answer is 2. The normal length of time for pushing is 2 hours. Anything over that time becomes an abnormal situation, and the healthcare provider needs to be notified. Changing the client's position is an appropriate nursing action within the 2-hour time period based on client need and fetal descent. Continuing current pushing supports techniques that have not been successful within the 2-hour time frame. Assessing client pain and fetal status are standards of care for laboring clients, but will not expedite childbirth for a client who has been pushing this long. Which of the following foods should the nurse encourage the mother to offer to her child with iron deficiency anemia? 1. Rice cereal, whole milk, and yellow vegetables. 2. Potato, peas, and chicken. 3. Macaroni, cheese, and ham. 4. Pudding, green vegetables, and rice. The correct answer is 2. Potatoes, peas, chicken, green vegetables, and rice cereal contain significant amount of iron and therefore will be recommended. Milk and yellow vegetables are not good iron sources. Rice by itself also is not a good source of iron. Macaroni, cheese, and ham are not high in iron. While pudding and green vegetables contain some iron, the better diet has protein and iron from chicken and potato. A woman who has given birth to a healthy neonate is being discharged. As part of discharge teaching, the nurse should instruct the client to observe vaginal discharge for a postpartum hemorrhage and notify the healthcare provider about 1. Bleeding that becomes lighter each day. 2. Clots the size of golf balls. 3. Saturating a pad in an hour. 4. Lochia that lasts longer than 1 week. The correct answer is 3. A postpartum client who saturates a pad in an hour or less at any time in the postpartum period is considered to be hemorrhaging. As the normal postpartum client heals, bleeding changes from red to pink to off-white. It also decreases in amount each day. Passing blood clots the size of a fist or larger is a reportable problem. Lochia varies in how long it lasts and is considered normal up to 6 weeks postpartum. A 24-year-old prima gravida client in active labor requests use of the jet hydrotherapy tub to aid in pain relief. The nurse bases a response on the understanding that this therapy is commonly contraindicated for clients with which of the following? 1. Ruptured membranes. 2. Multifetal gestation. 3. Diabetes mellitus. 4. Hypotonic labor patterns. The correct answer is 1. Some primary healthcare providers do not allow clients with ruptured membranes to use a hot tub or jet hydrotherapy tub during labor for fear of infections. The temperature of the water should be between 98 degrees Fahrenheit and 100 degrees Fahrenheit to prevent hyperthermia. Jet hydrotherapy is not contraindicated for clients with multifetal gestation, diabetes mellitus, or hypotonic labor patterns. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. In which of the following maternal locations would the nurse place the ultrasound transducer of the external electronic fetal heart rate monitor if a fetus at 34 weeks gestation is in the left occipital-anterior position? 1. Near the symphysis pubis. 2. 2 inches above the umbilicus. 3. Below the umbilicus on the left side. 4. At the level of the umbilicus. The correct answer is 3. As the uterus contracts, the abdominal wall rises and, when external monitoring is used, presses against the transducer. This movement is transmitted into an electrical current, which is then recorded with the fetus in the LOA position. The cardiotransducer should be placed below the umbilicus on the side where the fetal back is located and uterine displacement during contractions is greatest. If the fetal back is near the symphysis pubis, the fetus is presenting as a transverse lie. If the fetus is in a breech position, the fetal back may be at or above the umbilicus. A client with schizophrenia comes to the outpatient mental health clinic 5 days after being discharged from the hospital. The client was given a 1-week supply of clozapine. The client tells a nurse that she has too much saliva and frequently needs to spit. The nurse interprets the client's statement as indicating which of the following? 1. Delusion, requiring further assessment. 2. Unusual reaction to clozapine. 3. Expected adverse effect of clozapine. 4. Unresolved symptom of schizophrenia. The correct answer is 3. Sialorrhea, excessive salivation, is commonly associated with clozapine therapy. The client can use a washcloth to wipe the saliva instead of spitting. It is an expected adverse effect of the drug, not a delusion, an unusual reaction, or an unresolved symptom of schizophrenia. The nurse explains to a newly admitted prima gravida client in active labor that, according to the gate control theory of pain, a closed gate means that the client should experience which of the following? 1. No pain. 2. Sharp pain. 3. Light pain. 4. Moderate pain. The correct answer is 1. According to the gate control theory of pain, a closed gate means that the client should feel no pain. The gate control theory of pain refers to the gate control mechanisms in the substantia gelatinosa that are capable of halting an impulse at the level of the spinal cord, so the impulse is never perceived at the brain level as pain. A prima gravida client with insulin-dependent diabetes tells a nurse that the contraction stress test performed earlier in the day was suspicious. The nurse interprets this test result as indicating that the fetal heart rate pattern showed which of following? 1. Frequent late decelerations. 2. Decreased fetal movement. 3. Inconsistent late decelerations. 4. Lack of fetal movement. The correct answer is 3. A contraction stress test is used to evaluate fetal well-being during a simulated labor. A suspicious contraction stress test indicates inconsistent late deceleration patterns requiring further evaluation. A negative contraction stress test indicates no late decelerations and is a desired outcome. A positive contraction stress test indicates fetal compromise with frequent late decelerations. Fetal movements are one of the parameters of the biophysical profile and are detected with non-stress testing. Decreased or absent fetal movements may indicate central nervous system dysfunction or prematurity. Lack of fetal movement or decreased fetal movement is not associated with contraction stress testing. The nurse notes that a client sitting in a chair has not gotten up in 1 hour. The client does not respond to verbal directions, and her arm has been extended over the armrest for 30 minutes. Which of the following should the nurse do next? 1. Assist the client out of the chair to lead her back to bed. 2. Give PRN prescribed doses of haloperidol, Haldol, and lorazepam. 3. Ask the client to describe what she is experiencing right now. 4. Sit quietly with the client until she begins to respond. The correct answer is 2. The client is exhibiting catatonic behavior, an acutely serious result of severe anxiety and psychosis. In this situation, the nurse needs to administer the PRN prescribed doses of haloperidol and lorazepam. They can be given together safely. Assisting the client out of the chair go back to bed, or sitting quietly until the client responds ignores the seriousness of the client's condition. It is unlikely that the client can describe what is being experienced. Crisis intervention plays a major role in the management of care for clients with chronic mental illnesses. Although the safety of the client and others is always a priority, these clients typically need crisis intervention in which of the following situations? Select all that apply. 1. Inability to keep outpatient appointments. 2. Signs of relapse and decompensation. 3. Threat of eviction from housing. 4. Unpaid bills and lack of food. 5. Occasionally missing a dose of medication. The correct answers are 2, 3, and 4. Although all of the situations require immediate attention, the inability to keep outpatient appointments is less critical than signs of relapse and decompensation, threat of eviction, and unpaid bills and lack of food. Occasionally missing a dose of medication usually will not precipitate a crisis for a client. After instruction of a prima gravida client at 8 weeks gestation, diagnosed with class 1 heart disease, about self-care during pregnancy, which of the following client statements would indicate the need for additional teaching? 1. I should avoid being near people who have a cold. 2. I may be given antibiotics during my pregnancy. 3. I should reduce my intake of protein in my diet. 4. I should limit my salt intake at meals. The correct answer is 3. The client needs a diet that is adequate in protein and calories to prevent anemia, which can place additional strain on the cardiac system, further compromising the client's cardiac status. The client should avoid contact with people who have infections because of the increased risk for developing endocarditis. The client may need antibiotics during the pregnancy to prevent endocarditis. Limiting sodium intake can help to prevent excessive expansion of blood volume and decrease cardiac workload. A nurse working at an outpatient mental health center, primarily with chronically mentally ill clients, receives a telephone call from the mother of a client who lives at home. The mother reports that the client has not been taking her medication and now is refusing to go to the sheltered workshop where she has worked for the past year. What should the nurse do first? 1. Call the director of the workshop for information about the client. 2. Reserve an inpatient bed in preparation for the client's admission. 3. Ask to speak to the client directly on the phone. 4. Make an appointment for the client to see the doctor. The correct answer is 3. The first thing that the nurse should do is to speak with the client on the phone and question her about perceptions or reasons that are interfering with her going to the sheltered workshop. This conveys that the nurse is interested and willing to help the client. The nurse should call the director of the workshop for information only if the nurse receives the client's permission. Making preparations for the client's admission is inappropriate and would not be done until the client's needs have been assessed and it is determined that the client requires hospitalization. Making an appointment with a doctor is inappropriate until the nurse has assessed the client's needs. In addition to developing over a period of hours or days, the nurse should assess delirium as distinguishable by which of the following characteristics? 1. Disturbances in cognition and consciousness that fluctuate during the day. 2. The failure to identify objects despite intact sensory functions. 3. Significant impairment in social or occupational functioning over time. 4. Memory impairment to the degree of being called amnesia. The correct answer is 1. Fluctuating symptoms are characteristic of delirium. The failure to identify objects despite intact sensory functions, significant impairment in social or occupational functioning over time, and memory impairment to the degree of being called amnesia all indicate dementia. A multigravida client is admitted to the hospital with a diagnosis of ectopic pregnancy. The nurse anticipates that, because the client's fallopian tube has not yet ruptured, which of the following may be prescribed? 1. Progestin contraceptives. 2. Medroxyprogesterone. 3. Methotrexate. 4. Diphyline. The correct answer is 3. Because the fallopian tube has not yet ruptured, methotrexate may be given, followed by leucovorin. This chemotherapeutic agent attacks the fast-growing zygote and trophoblast cells. RU-486 is also effective. A hysterosalpingogram is usually performed after chemotherapy to determine whether the tube is still patent. Progestin-only contraceptives and medroxyprogesterone are ineffective in clearing the fallopian tube. Diphyline is a bronchodilator and is not used. Which of the following interventions would be most likely to prevent the development of acute respiratory distress syndrome? 1. Teaching cigarette smoking cessation. 2. Maintaining adequate serum potassium levels. 3. Monitoring clients for signs of hypercapnia. 4. Replacing fluids adequately during hypovolemic states. The correct answer is 4. One of the major risk factors for development of ARDS is hypovolemic shock. Adequate fluid replacement is essential to minimize the risk of ARDS in these clients. Teaching smoking cessation does not prevent ARDS. An abnormal serum potassium level and hypercapnia are not risk factors for ARDS. A client has the following arterial blood gas values. pH is 7.52, PaO2 is 50, PaCO2 is 28, HCO3 is 24 milliequivalents per liter. Based upon the client's PaO2, which of the following conclusions would be accurate? 1. The client is severely hypoxic. 2. The oxygen level is low but poses no risk for client. 3. The client's PaO2 level is within normal range. 4. The client requires oxygen therapy with very low oxygen concentrations. The correct answer is 1. Normal PaO2 level ranges from 80 to 100. When PaO2 falls to 50, the nurse should be alert for signs of hypoxia and impending respiratory failure. An oxygen level this low poses a severe risk for respiratory failure. The client will require oxygenation at a concentration that maintains the PaO2 at 55 to 60 or more. Which of the following nursing interventions would promote effective airway clearance in a client with acute respiratory distress? 1. Administering oxygen every 2 hours. 2. Turning the client every 4 hours. 3. Administering sedatives to promote rest. 4. Suctioning if cough is ineffective. The correct answer is 4. The nurse should suction the client if the client is not able to cough up secretions and clear the airway. Administering oxygen will not promote airway clearance. The client should be turned every 2 hours to help move secretions. Every 4 hours is not often enough. Administering sedatives is contraindicated in acute respiratory distress because sedatives can depress respirations. The nurse should place a client being admitted to the hospital with suspected tuberculosis on what type of isolation? 1. Standard precautions. 2. Contact precautions. 3. Droplet precautions. 4. Airborne precautions. The correct answer is 4. Airborne precautions prevent transmission of infectious agents that remain infectious over long distances when suspended in the air. The preferred placement is in an isolation single client room that is equipped with special air handling and ventilation, a negative pressure room, or an area that exhausts room air directly outside or through HEPA filters. Should be used if recirculation is unavoidable. The nurse is caring for a client who has been placed on droplet precautions. Which of the following protective gear is required to take care of this client? Select all that apply. 1. Gloves. 2. Gown. 3. Surgical mask. 4. Glasses. 5. Respirator. The correct answers are 1, 2, 3, and 4. Gloves, gown, surgical mask, and eye protection/glasses are worn to protect healthcare workers and to help prevent the spread of infection when clients are placed in droplet isolation. Because droplets are too heavy to be airborne, a respirator is not required when caring for a client in droplet precautions. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. On the second postoperative day after repair of a cleft palate, which of the following should a nurse use to feed a toddler? 1. Cup. 2. Straw. 3. Rubber tip syringe. 4. Large hole nipple. The correct answer is 1. A cup is a preferred drinking or eating utensil after repair of a cleft palate. At the age when repair is done, the child is ordinarily able to drink from a cup. Use of a cup avoids having to place a utensil in the mouth, which would increase the potential for injury to the suture lines. The nurse is administering gastrostomy feedings to an infant after surgery to correct a tracheoesophageal fistula. To prevent air from entering the stomach, once the syringe barrel is attached to the gastrostomy tube, the nurse should 1. Unclamp the tube after pouring a complete amount of formula to be administered into the syringe barrel. 2. Pour all the formula to be administered into the syringe barrel after opening the clamp. 3. Maintain a continuous flow of formula down the side of the syringe barrel. Once the clamp is opened, allow a small amount of formula to enter the stomach before pouring more formula into the syringe barrel. The correct answer is 1. The best way to prevent air from entering the stomach when feeding an infant through a gastrostomy tube is to open the clamp after all the formula has been placed in the syringe barrel. Doing so prevents air from mixing with the formula and thus being introduced into the stomach. Pouring all the formula into the barrel after opening the clamp. Maintaining a continuous flow of formula down the side of the barrel after unclamping the tube, and allowing a small amount of formula to enter the stomach before adding more formula to the barrel permit air to enter the stomach. After teaching the mother of a neonate who has successfully undergone surgery to repair a low anorectal anomaly, the mother indicates that she understands her child's prognosis when she states which of the following? 1. My child will need to wear protective pads until puberty. 2. My child will need extra fluids to prevent constipation. 3. My child will probably always need a high-fiber diet. 4. My child has a good chance of being potty trained. The correct answer is 4. Children who undergo surgical correction for low anorectal anomalies, as infants usually are continent. Fecal continence can be expected after successful correction of anal membrane atresia. Therefore, this child probably has a good chance of being potty trained and will not need to wear protective pads. Extra fluids and a high-fiber diet are not required to prevent constipation. Children with high anorectal anomalies may or may not achieve continence. When an infant with pyloric stenosis is admitted to the hospital, which of the following should the nurse do first? 1. Weigh the infant. 2. Begin an intravenous infusion. 3. Switch the infant to an oral electrolyte solution. 4. Orient the mother to the hospital unit. The correct answer is 1. Unless the infant is in hypovolemic shock. Obtaining a baseline weight is an important first action because the weight is used to calculate the child's fluid and electrolyte needs. The intravenous fluid rate and the amounts of electrolytes to be added to the fluid are based on the infant's weight. The weight also helps determine the infant's degree of dehydration. The intravenous infusion is initiated once the weight has been obtained. The child with pyloric stenosis typically experiences vomiting and is at risk for fluid volume deficit and metabolic acidosis. As a result, oral food and fluids are withheld, and the infant is allowed nothing by mouth. Fluid replacement is given intravenously. Orientation can wait until treatment is underway. Immediately after the first oral feeding after corrective surgery for pyloric stenosis, a 4-week-old infant is fussy and restless. Which of the following actions would be most appropriate at this time? 1. Encourage the parents to hold the infant. 2. Hang a mobile over the infant's crib. 3. Give the infant more to eat. 4. Give the infant a pacifier to suck on. The correct answer is 4. Giving the infant a pacifier would help meet non-nutritive sucking needs and ensure oral gratification. Additionally, sucking aids in calming the infant. Holding the infant to decrease fussiness and restlessness is more effective in an older infant. Also, the reason for the infant's fussiness needs to be explored. Hanging a mobile over the crib frequently does not decrease fussiness. After surgery to correct pyloric stenosis, feeding the infant more formula would lead to vomiting, putting additional stress on the operative site. Assessment reveals that the fetus of a multigravida client is at +1 station and 8 centimeters dilated. Based on these data, the nurse should first 1. Ask the anesthesiologist to increase epidural infusion rate. 2. Assist the client to push if she feels the need to do so. 3. Encourage the client to breathe through the urge to push. 4. Support family members in providing comfort measures. The correct answer is 3. The urge to push is often present when the fetus reaches plus stations. This client does not have a cervix that is completely dilated, and pushing in this situation may tear the cervix. Encouraging the client to breathe through the urge to push is the most appropriate strategy and allows the cervix to dilate before pushing. Increasing the level of the epidural is inappropriate, as nursing would like to have the client be able to push when she is fully dilated. This may occur quickly with a multigravida client. Comfort measures are important for the client at this time, but are not the highest priority for nurse. Which of the following actions indicates that the parents of 12-month-old with iron deficiency anemia understand how to administer iron supplements? Select all that apply. 1. They administer iron supplements in combination with fruit juice. 2. They administer iron supplements with meals. 3. They report dark stools. 4. They brush the child's teeth after administering the iron supplements. 5. They decrease dietary intake of foods fortified with iron. The correct answers are 1 and 4. Parent teaching concerning a child with iron deficiency anemia should include directions about giving iron combined with fruit juice in divided doses between meals and with a dropper for a 12-month-old or through a straw for older toddlers. Iron stains teeth, so brushing the teeth and administering liquid iron through a dropper or straw are necessary to prevent staining the teeth. Iron should not be given with milk, antacids, or tea and should be administered on an empty stomach. Iron will cause the stool to become black or green, which is normal and does not need to be reported. However, light-colored stools indicate the iron is not being absorbed and should be reported. A client in sickle cell crisis has been hospitalized during her pregnancy. After giving discharge instructions, the nurse determines the client needs further teaching when she states which of the following? 1. I will need more frequent appointments during the remainder of the pregnancy. 2. Signs of any type of infection must be reported immediately. 3. At the earliest signs of crisis, I need to seek treatment. 4. I have this disease because I don't eat enough food with iron. The correct answer is 4. Sickle cell disease is an autosomal recessive disorder requiring both parents to have a sickle cell trait to pass the disease to a child. Deoxygenated hemoglobin cells assume a sickle shape and obstruct tissues. Tissue obstruction causes hypoxia to the area and results in pain, called sickle cell crisis. This type of anemia is an inherited disorder. It is not caused by lack of iron in the diet. Self-monitoring for any type of infections or sickle cell crisis and increased frequency of antenatal care visits are part of the teaching plan of care. The cervix of a 15-year-old prima gravida client admitted to the labor area is 2 centimeters dilated and 50% effaced. Her membranes are intact, and contractions are occurring every 5 to 6 minutes. Which of the following should the nurse recommend at this time? 1. Resting in the right lateral recumbent position. 2. Lying in the left lateral recumbent position. 3. Walking around in the hallway. 4. Sitting in a comfortable chair for a period of time. The correct answer is 3. Most authorities suggest that a woman in an early stage of labor should be allowed to walk if she wishes, as long as no complications are present. Birthing centers and single-room maternity units allow women considerable latitude without much supervision at this stage of labor. Gravity and walking can assist the process of labor in some clients. If the client becomes tired, she can rest in bed in the left lateral recumbent position or sit in a comfortable chair. Resting in the left lateral recumbent position improves circulation to the fetus. A nurse is discussing preterm labor in a prenatal class. After class, a client and her partner ask the nurse to identify again the nursing strategies to prevent preterm labor. The clients need further instruction when they state which of the following? 1. I need to stay hydrated all the time. 2. I need to avoid any infections. 3. I should include frequent rest breaks if we travel. 4. Changing to filter cigarettes is helpful. The correct answer is 4. Smoking in any form is contraindicated in pregnancy, regardless of the type of filtering system used. Smoking is a major risk factor for preterm labor and decreased fetal weight. Dehydration is a risk factor for preterm labor, as is prolonged standing and remaining in one position. Infection is thought to be a primary cause of preterm labor, and the client would need to avoid contracting any type of infection. While taking trips, frequent emptying of the bladder prevents infection and ambulates the woman. As the nurse enters a room of a newly admitted prima gravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. The nurse should do which in order of priority from first to last? 1. Call for immediate assistance. 2. Turn the client to her side. 3. Assess for ruptured membranes. 4. Maintain airway. The correct order is 1, 3, 2, and 4. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. Next, the nurse should turn the client to her side and then maintain the airway by keeping the neck hyperextended. When the seizure is over, the nurse should assess the client for ruptured membranes and the fetal status. After a lengthy labor process, a prima gravida client gives birth to a healthy newborn boy with a moderate amount of skull molding. Which of the following would the nurse include when explaining to the parents about this condition? 1. It is typically seen with breech births. 2. It usually lasts a day or two before resolving. 3. It is unusual when the brow is the presenting part. 4. Surgical intervention may be necessary to alleviate pressure. The correct answer is 2. Molding occurs with vaginal births and is commonly seen in newborns. This is especially true with prima gravida clients experiencing a lengthy labor process. Parents need to be reassured that it is not permanent and that it typically lasts a day or two before resolving. Molding rarely is present if the fetus is in a breech or brow presentation. Surgical intervention is not necessary. A prima gravida client at 34 weeks gestation is experiencing contractions every 3 to 4 minutes, lasting for 35 seconds. Her cervix is 2 centimeters dilated and 50% effaced. While the nurse is assessing the client's vital signs, the client says, "I think my bag of water just broke." Which of the following would the nurse do first? 1. Check the status of the fetal heart rate. 2. Turn the client to her right side. 3. Test the leaking fluid with nitrazine paper. 4. Perform a sterile vaginal examination. The correct answer is 1. The priority is to determine whether a prolapsed cord has occurred as a result of the spontaneous rupture of membranes. The nurse's first action should be to check the status of the fetal heart rate. Complications of premature rupture of the membranes include a prolapsed cord or increased pressure on the fetal umbilical cord inhibiting fetal nutrient supply. Variable decelerations or fetal bradycardia may be seen on the external fetal monitor. The cord also may be visible. Turning the client to her right side is not necessary. If the cord does prolapse, the client should be placed in a kneaded chest or Trendelenburg position. Checking the fluid with nitrazine paper and vaginal examination are appropriate once the status of the fetus has been evaluated. A newly admitted client with an acute exacerbation of psychotic symptoms of chronic undifferentiated schizophrenia is having trouble deciding whether to live in a group home or a supervised apartment. When caring for this client, which of the following activities is most appropriate for the nurse to ask the client to do initially? 1. List the pros and cons of each housing option. 2. Choose between apple and orange juice for breakfast. 3. Identify why the client cannot live in an unsupervised apartment. 4. Decide which staff member the client would like to have today. The correct answer is 2. The client is in an acute psychotic state and cannot process complex decisions or explain complex situations. Therefore, the nurse would focus on decision making involving simple choices, listing the pros and cons of each housing option, and identifying why the client cannot live in an unsupervised apartment involve complex decision-making skills. Deciding which staff member to have today is a difficult and threatening decision for a client who is psychotic. Assessment of a prima gravida client reveals cervical dilation at 8 centimeters and complete effacement. The client has severe back pain during this phase of labor. The nurse explains that the client's severe back pain is most likely caused by the fetal occiput being in a position that is identified as which of the following? 1. Breech. 2. Transverse. 3. Posterior. 4. Anterior. The correct answer is 3. When a client has severe back pain during labor, the fetus is most likely in an occipito-posterior position. This means that the fetal head presses against the client's sacrum, causing marked discomfort during contractions. These sensations may be so intense that the client requests medication for relief of the back pain rather than contractions. Breech presentation and transverse lie are usually known prior to 8 centimeters dilation, and a cesarean section is performed. Fetal occiput anterior position does not increase the pain felt during labor. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. At 38 weeks gestation, a prima gravida client with poorly controlled diabetes and severe preeclampsia is admitted for cesarean birth. The nurse explains to the client that childbirth helps to prevent which of the following? 1. Neonatal hyperbilirubinemia. 2. Congenital anomalies. 3. Perinatal asphyxia. 4. Stillbirth. The correct answer is 4. Stillbirths caused by placental insufficiency occur with increased frequency in women with diabetes and severe preeclampsia. Clients with poorly controlled diabetes may experience unanticipated stillbirth as a result of premature aging of the placenta. Therefore, labor is commonly induced in these clients before term. If induction of labor fails, a cesarean section is necessary. Induction and cesarean section do not prevent neonatal hyperbilirubinemia, congenital anomalies, or perinatal asphyxia. A successful real estate agent brought to the clinic after being arrested for harassing and stalking his ex-wife denies any other symptoms or problems except anger about being arrested. The ex-wife reports to the police, "He is fine except for this irrational belief that we will remarry." When collaborating with a healthcare provider about a plan of care, which of the following will be most effective for the client at this time? 1. A prescription for olanzapine 10 milligrams daily. 2. A joint session with the client and his ex-wife. 3. A prescription for fluoxetine 20 milligrams every morning. 4. Referral to an outpatient therapist. The correct answer is 4. Follow-up counseling is appropriate because of the client's anger and inappropriate behaviors. The goal is to help the client deal with the end of his marriage. A joint session might have been useful before the divorce and arrest, but not after. The client is exhibiting no signs or symptoms of schizophrenia or psychosis, so olanzapine is not indicated. The client is not exhibiting signs of depression, so fluoxetine is not indicated. The nurse observes a client in a group who is reminiscing about his past. Which effect should the nurse expect reminiscing to have on the client's functioning in the hospital? 1. Increase the client's confusion and disorientation. 2. Cause the client to become sad. 3. Decrease the client's feelings of isolation and loneliness. 4. Keep the client from participating in therapeutic activities. The correct answer is 3. Reminiscing can help reduce depression in an elderly client and lessens feelings of isolation and loneliness. Reminiscing encourages a focus on positive memories and accomplishments, as well as shared memories with other clients. An increase in confusion and disorientation is most likely the result of other cognitive and situational factors, such as loss of short-term memory, not reminiscing. The client will not likely become sad because reminiscing helps the client connect with positive memories. Keeping the client from participating in therapeutic activities is less likely with reminiscing. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 2. Rationale. The loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. When developing a community-based service program for clients with chronic mental illnesses, which of the following is the least important? 1. Partial programs. 2. Psychiatric home care. 3. Residential services. 4. Long-term hospitals. The correct answer is 4. For a community-based program, the need for long-term hospitalization is least needed if the other services, such as partial programs, psychiatric home care, and residential services, are available and accessible. Which of the following areas is a priority to evaluate when completing discharge planning for a client who has had a lobectomy for treatment of lung cancer? 1. The support available to assist the client at home. 2. The distance the client lives from a hospital. 3. The client's ability to do home blood pressure monitoring. 4. The client's knowledge of the causes of lung cancer. The correct answer is 1. Because clients are discharged as soon as possible from the hospital, it is essential to evaluate the support they have to assist them with self-care at home. The distance the client lives from the hospital is not a critical factor in discharge planning. There are no data indicating that home blood pressure monitoring is needed. Knowledge of the causes of lung cancer, although important, is not the most essential area to evaluate given the client's postoperative status. When teaching a client to deep breathe effectively after a lobectomy, the nurse should instruct the client to do which of the following? 1. Contract the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds, then exhale. 2. Contract the abdominal muscles. Take a deep breath through the mouth and exhale slowly as if trying to blow out a candle. 3. Relax the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds. 4. Relax the abdominal muscles. Take a deep breath through the mouth and exhale slowly over 10 seconds. The correct answer is 1. The recommended procedure for teaching clients postoperatively to deep breathe includes contracting the abdominal muscles and taking a slow, deep breath through the nose. This breath is held 3 to 5 seconds, which facilitates alveolar ventilation by improving the inspiratory phase of ventilation. Exhaling slowly as if trying to blow out a candle is a technique used in pursed lip breathing to facilitate exhalation in clients with chronic obstructive pulmonary disease. It is recommended that the abdominal muscles be contracted, not relaxed, to promote deep breathing. The client should breathe through the nose. A client who underwent a lobectomy and has a water-sealed chest drainage system is breathing with a little more effort and at a faster rate than 1 hour ago. The client's pulse rate is also increased. The nurse should 1. Check the tubing to ensure that the client is not lying on it or kinking it. 2. Increase the suction. 3. Lower the drainage bottles 2 to 3 feet below the level of the client's chest. 4. Ensure that the chest tube has 2 clamps on it to prevent air leaks. The correct answer is 1. In this case, there may be some obstruction to the flow of air and fluid out of the pleural space, causing air and fluid to collect and build up pressure. This prevents the remaining lung from re-expanding and can cause a mediastinal shift to the opposite side. The nurse's first response is to assess the tubing for kinks or obstruction. Increasing the suction is not done without a physician's prescription. The normal position of the drainage bottles is 2 to 3 feet below chest level. Clamping the tubes obstruct the flow of air and fluid out of the pleural space and should not be done. A young adult is admitted to the emergency department after an automobile accident. The client has severe pain in the right chest where there was an impact on the steering wheel. Which is the primary client goal at this time? 1. Reduce the client's anxiety. 2. Maintain adequate oxygenation. 3. Decrease chest pain. 4. Maintain adequate circulating volume. The correct answer is 2. Blunt chest trauma may lead to respiratory failure, and maintenance of adequate oxygenation is a priority for the client. Decreasing the client's anxiety is related to maintaining effective respirations and oxygenation. Although pain is distressing to the client and can increase anxiety and decrease respiratory effectiveness, pain control is secondary to maintaining oxygenation. Maintaining adequate circulatory volume is also secondary to maintaining adequate oxygenation. A client undergoes surgery to repair lung injuries. Postoperative prescriptions include the transfusion of 1 unit of packed red blood cells at a rate of 60 milliliters per hour. How long will this transfusion take to infuse? 1. 2 hours. 2. 4 hours. 3. 6 hours. 4. 8 hours. The correct answer is 2. 1 unit of packed red blood cells is about 250 milliliters. If the blood is delivered at a rate of 60 milliliters per hour, it will take about 4 hours to infuse the entire unit. The transfusion of a single unit of packed red blood cells should not exceed 4 hours to prevent the growth of bacteria and minimize the risk of septicemia. When assessing a client with chest trauma, the nurse notes that the client is taking small breaths at first, then bigger breaths, then a couple of small breaths, then 10 to 20 seconds of no breaths. The nurse should chart the breathing pattern as 1. Cheyne-Stokes respiration. 2. Hyperventilation. 3. Obstructive sleep apnea. 4. Beals respiration. The correct answer is 1. Cheyne-Stokes respiration is defined as a regular cycle that starts with normal breaths, which increase and then decrease followed by a period of apnea. It can be related to heart failure or a dysfunction of the respiratory center of the brain. Hyperventilation is the increased rate and depth of respirations. Obstructive sleep apnea is recurring episodes of upper airway obstruction and reduced ventilation. Beals respiration, also known as cluster breathing, is periods of normal respirations followed by varying periods of apnea. Which of the following statements should the nurse use to describe to the parents why their child with leukemia is at risk for infections? 1. Play activities are too strenuous. 2. Vitamin C intake is reduced over a period of time. 3. The number of red blood cells is inadequate for carrying oxygen. 4. Immature white blood cells are incapable of handling an infectious process. The correct answer is 4. In leukemia, the number of normal white blood cells that are capable of fighting an infection is decreased. Although there is an increased number of immature white blood cells, they are unable to combat infection. Therefore, a child with leukemia is subject to infection. The major morbidity and mortality factor associated with leukemia is infection resulting from the presence of granulocytopenia. While increased activity may cause fatigue, it does not put the child at risk for infection. Vitamin C intake should not decrease if the child has adequate dietary intake. Decreased red blood cells are not directly caused by infection. After doing well for a period of time, a child with leukemia develops an overwhelming infection. The child's death is imminent. Which of the following statements offers the nurse the best guide in making plans to assist the parents in dealing with their child's imminent death? 1. Knowing that the prognosis is poor helps prepare relatives for the death of children. 2. Relatives are especially grieved when a child does well at first but then declines rapidly. 3. Trust in healthcare personnel is most often destroyed by a death that is considered untimely. 4. It is more difficult for relatives to accept the death of an older child than that of a toddler. The correct answer is 2. It has been found that parents are more grieved when optimism is followed by defeat. The nurse should recognize this when planning various ways to help the parents of a dying child. It is not necessarily true that knowing about a poor prognosis for years helps prepare parents for a child's death. Death is still a shock when it occurs. Trust in healthcare personnel is not necessarily destroyed when a death is untimely if the family views the personnel as having done all that was possible. It is not more difficult for parents to accept the death of an older child than that of a younger child. An infant has been transferred from the ICU to the pediatric floor after undergoing surgery to correct a heart defect. Which tasks can the charge nurse delegate to the licensed practical nurse? Select all that apply. 1. Administering oral medications. 2. Administering IV morphine. 3. Obtaining vital signs. 4. Morning hygiene. 5. Circulation checks. 6. Discharge teaching. The correct answers are 1, 3, and 4. The RN scope of practice includes assessment, planning, implementing, and evaluation. Only aspects of care implementation may be delegated to the LPN, and the exact skills that may be delegated vary by state and institution. In general, LPNs have been trained to perform the tasks of administering oral medications, performing hygiene, and recording the intake and output. LPNs may also take vital signs to gather data, but the RN must interpret the data. Administering IV morphine requires assessment of the client's respiratory status before, during, and after procedure. It should be done by the RN. Circulation checks are assessments the RN should complete. A multigravida client thought to be at 14 weeks gestation reports that she is experiencing such severe morning sickness that she has not been able to keep anything down for a week. The nurse should assess for signs and symptoms of which of the following? 1. Hypercalcemia. 2. Hypobilirubinemia. 3. Hypokalemia. 4. Hyperglycemia. The correct answer is 3. Gastrointestinal secretion losses from excessive vomiting, diarrhea, and excessive perspiration can result in hypokalemia, hyponatremia, decreased chloride levels, metabolic alkalosis, and eventual acidosis if precautionary measures are not taken. Ketones may be present in the urine. Dehydration can lead to poor maternal and fetal outcomes. Persistent vomiting can lead to hypocalcemia, not hypercalcemia. Hyperbilirubinemia, not hypobilirubinemia, is typical in clients with hyperemesis. Persistent vomiting may affect liver function and subsequently the excretion of bilirubin from the body. Hypoglycemia, not hyperglycemia, may occur as a result of decreased intake of food and fluids, decreased metabolism of nutrients, and excessive vomiting. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is teaching the parents of a child with sickle cell disease. To instruct them on how to prevent sickle cell crisis, she should include which instruction? 1. Restrict the child's fluid intake to less than 1 quart per day. 2. Drink at least 2 quarts of fluids per day. 3. Stay away from other teenagers. 4. Avoid physical activity. The correct answer is 2. Increasing fluid intake and being well hydrated will help prevent cell stasis in the small vessels. Restricting fluids causes stasis of red blood cells and promotes obstruction and increases the chance of sickling with hypoxia and pain to the part that is involved. Clients with sickle cell disease should stay away from others who have infections. When the spleen of a client who has sickle cell disease has become fibrotic and non-functional, the client is more susceptible to infections. Clients with sickle cell disease should not avoid physical activity as long as the client stays well hydrated. After suction and evacuation of a complete hydatidiform mole, the 28-year-old multigravida client asked the nurse when she can become pregnant again. The nurse would advise the client not to become pregnant again for at least which of the following time spans? 1. 6 months. 2. 12 months. 3. 18 months. 4. 24 months. The correct answer is 2. A client who has experienced a molar pregnancy is at risk for development of choriocarcinoma and requires close monitoring of human chorionic gonadotropin levels. Pregnancy would interfere with monitoring these levels. High HCG titers are common for up to 7 weeks after the evacuation of the mole, but then these levels gradually begin to decline. Clients should have a pelvic examination and a blood test for HCG titers every month for 6 months, and then every 2 months for 1 year. Gradually declining HCG levels suggest no complications. Increasing levels are indicative of a malignancy and should be treated with methotrexate. If after 1 year the HCG levels are negative, the client is theoretically free of the risk of a malignancy developing and could plan another pregnancy. A 21-year-old primigravida client at 40 weeks gestation is admitted to the hospital in active labor. The client's cervix is 8 centimeters and completely effaced at 0 station. During the transition phase of labor, which of the following is a priority nursing problem? 1. Urinary retention. 2. Hyperventilation. 3. Ineffective coping. 4. Pain. The correct answer is 4. During transition, contractions are increasing in frequency, duration, and intensity. The most appropriate nursing problem is pain related to strength and duration of the contractions. Insufficient information is provided in the scenario to support the other listed nursing diagnoses. Urinary retention would be appropriate if the client had a full bladder and was unable to void. Hyperventilation might apply if client was breathing too rapidly, but there is no evidence this is occurring. Ineffective coping might apply if the client said, "I can't do this," or something similar. Because of the risks associated with administration of factor VIII concentrate, the nurse should teach the child's family to recognize and report which of the following? 1. Yellowing of the skin. 2. Constipation. 3. Abdominal distension. 4. Puffiness around the eyes. The correct answer is 1. Because factor VIII concentrate is derived from large pools of human plasma, the risk of hepatitis is always present. Clinical manifestations of hepatitis include yellowing of the skin, mucous membranes, and sclera. Use of factor VIII concentrate is not associated with constipation, abdominal distension, or puffiness around the eyes. Several pregnant clients are waiting to be seen in the triage area of the obstetrical unit. Which client should the nurse see first? 1. A client at 13 weeks gestation experiencing nausea and vomiting 3 times a day with +1 ketones in her urine. 2. A client at 37 weeks gestation who is an insulin-dependent diabetic and experiencing 3 to 4 fetal movements per day. 3. A client at 32 weeks gestation who is preeclampsia and +3 proteinuria who is returning for evaluation of epigastric pain. 4. A client at 17 weeks gestation who is not feeling fetal movement at this point in her pregnancy. The correct answer is 3. A preeclamptic client with +3 proteinuria and epigastric pain is at risk for seizing, which would jeopardize the mother and the fetus. Thus, this client would be the highest priority. The client at 13 weeks gestation with nausea and vomiting is a concern because the presence of ketones indicates that her body does not have glucose to break down. However, this situation is a lower priority than the preeclamptic client or the insulin-dependent diabetic. The insulin-dependent diabetic is a high priority. However, fetal movement indicates that the fetus is alive but may be ill. As few as 4 fetal movements in 12 hours can be considered normal. The client may need additional testing to further evaluate fetal well-being. The client who is at 17 weeks gestation may be too early in her pregnancy to experience fetal movement and would be the last person to be seen. A 19-year-old prima gravida client at 38 weeks gestation is 7 centimeters dilated and the presenting part is at +1 station. The client tells a nurse, "I need to push." Which of the following would the nurse do next? 1. Use a McDonald procedure to widen the pelvic opening. 2. Increase the rate of oxygen and intravenous fluids. 3. Instruct the client to use a pant blow pattern of breathing. 4. Tell the client to push only when absolutely necessary. The correct answer is 3. Pushing during the first stage of labor, when the urge is felt but the cervix is not completely dilated, may produce cervical swelling, making labor more difficult. The client should be encouraged to use a pant blow pattern of breathing to help overcome the urge to push. The McDonald procedure is used for cervical circlage for an incompetent cervix and is inappropriate here. Increasing the rate of oxygen and intravenous fluids will not alleviate the pressure that the client is feeling. The client should not push even if she feels the urge to do so, because this may result in cervical edema at 7 centimeters dilation. A prima gravida client at 30 weeks gestation has been admitted to the hospital with premature rupture of the membranes without contractions. Her cervix is 2 centimeters dilated and 50% effaced. The nurse should next assess the clients. 1. Red blood cell count. 2. Degree of discomfort. 3. Urinary output. 4. Temperature. The correct answer is 4. Premature rupture of the membranes is commonly associated with chorioamnionitis or an infection. A priority assessment for the nurse to make is to document the client's temperature every 2 to 4 hours. Temperature elevation may indicate an infection. Lethargy and an elevated white blood cell count also indicate infection. The red blood cell count would provide information related to anemia, not infection. The client is not in labor. Therefore, assessing the degree of discomfort is not a priority at this time. Urinary output is not a reliable indicator of an infection, such as chorioamnionitis. A client with undifferentiated schizophrenia tells a nurse that he doesn't go out much because he doesn't have anywhere to go and he doesn't know anyone in the apartment where he's staying. Which of the following actions is most beneficial for the client at this time? 1. Encouraging him to call his family to visit more often. 2. Making an appointment for the client to see the nurse daily for 2 weeks. 3. Thinking about the need for rehospitalization for the client. 4. Arranging for the client to attend day treatment at the clinic. The correct answer is 4. Because the client can live in an apartment setting, further development of independent functioning and the skills to gain as much independence as he is capable of need to be fostered, including getting out and developing new friendships. Arranging for participation in day treatment is most beneficial at this time. Family visits and daily nursing visits do not encourage the client to do this. Making an appointment for 2 weeks later puts the client's needs off. Lack of social relationships is not a sufficient reason for rehospitalization. A prima gravida client in active labor has had no anesthesia. The client's cervix is 7 centimeters dilated, and she is starting to feel considerable discomfort during contractions. The nurse should instruct the client to change from slow chest breathing to which of the following? 1. Rapid, shallow chest breathing. 2. Deep chest breathing. 3. Rapid pant blow breathing. 4. Slow abdominal breathing. The correct answer is 1. The psychoprophylaxis method of childbirth suggests using slow chest breathing until it becomes ineffective during labor contractions, then switching to shallow chest breathing, mostly at the sternum, during the peak of a contraction. The rate is 50 to 70 breaths per minute. Deep chest breathing is appropriate for the early phase of labor, in which the client exhibits less frequent contractions. When transition nears, a rapid pant blow pattern of breathing is used. Slow abdominal breathing is very difficult for clients in labor. When developing a teaching plan for a prima gravida client with insulin-dependent diabetes about monitoring blood glucose control and insulin dosages at home, which of the following would the nurse expect to include as a desired target range for blood glucose levels? 1. 40 to 60 milligrams per deciliter between 2 o'clock and 4 p.m. 2. 70 to 100 milligrams per deciliter before meals and bedtime snacks. 3. 110 to 140 milligrams per deciliter before meals and bedtime snacks. 4. 140 to 160 milligrams per deciliter 1 hour after meals. The correct answer is 2. The goal is to maintain blood plasma glucose levels at 70 to 100 milligrams per deciliter before meals and bedtime snacks. Below 60 milligrams per deciliter indicates hypoglycemia. A range of 110 to 140 milligrams per deciliter suggests hyperglycemia. The target range 1 hour after meals is 100 to 120 milligrams per deciliter. During a home visit, the nurse discovers that the client is less verbal, less active, less responsive to directions, severely anxious, and more stuporous. The nurse interprets these findings to indicate that the client needs which of the following? 1. A sleep aid. 2. A clinic appointment. 3. An increase in medication. 4. Immediate medical evaluation. The correct answer is 4. The client is exhibiting symptoms of becoming catatonic and unable to care for himself, and needs immediate evaluation and possible hospitalization. A sleep aid is not sufficient to treat this client. The client's worsening condition dictates action without waiting for a clinic appointment. An increase in medication may be indicated, but hospitalization is required first for safety. An elderly client was prescribed Ativan 1 milligram 3 times a day to help calm her anxiety after her husband's death. The next day, the client calls her daughter asking when she is picking her up to go to the graveside. The client says she has been walking up and down the driveway for the past hour, waiting for her daughter. Noting the client's agitation, hyperactivity, and insistence, the daughter calls the nurse to report her mother's behavior. Which of the following would the nurse suspect is the cause of the mother's behavior? And what action would she suggest? 1. The client is manic and may need a sleeping pill. 2. The client is experiencing a medication interaction and should go to the emergency department. 3. The client is experiencing a paradoxical reaction to Ativan and should stop the new medication immediately. 4. The client is overcome by grief and probably needs an antidepressant. The correct answer is 3. Paradoxical responses to benzodiazepines are more common in children and the elderly than other age groups and generally occur at the beginning of treatment. Grief/depression in the elderly is more likely to result in fatigue and withdrawal than hyperactivity and agitation. Treatment with a sleeping medication chemically related to benzodiazepines is likely to result in an increase rather than decrease in agitation symptoms in elderly clients. A medication interaction is possible, but less likely since most pharmacies screen for drug interactions when filling prescriptions. A prima gravida client with class 2 heart disease who is visiting the clinic at 8 weeks gestation tells the nurse that she has been maintaining a low-sodium, 1,800 calories diet. Which of the following instructions should the nurse give the client? 1. Avoid folic acid supplements to prevent megaloblastic anemia. 2. Severely restrict sodium intake throughout the pregnancy. 3. Take iron supplements with milk to enhance absorption. 4. Increase caloric intake to 2,200 calories daily to promote fetal growth. The correct answer is 4. The client can continue a low-sodium diet but should increase the caloric intake to 2,200 calories daily to provide adequate nutrients to support fetal growth and development. Folic acid supplements, a standard component of care, are used to prevent folic acid deficiency, which is associated with megaloblastic anemia during pregnancy. Severe restriction of sodium intake is not recommended because sodium is necessary to maintain fluid volume. Iron supplements should be taken with acidic foods and fluids for maximum absorption. Milk decreases the absorption of iron. A 23-year-old client diagnosed with schizophrenia cheerfully announces, "My mom and I are so excited that I'm pregnant. She's willing to help us take care of the baby too." Which of the following reasons should cause the nurse to be concerned about this situation? 1. The client did not say that the father of the baby was excited about this. 2. The mother is not likely to provide enough help for what the client needs. 3. Symptom management will be difficult in early pregnancy without medications. 4. The client will have difficulty financially supporting the baby. The correct answer is 3. Because antipsychotic agents cross the placental barrier and can be teratogenic, they are to be avoided during pregnancy, especially during the first trimester. Later in the pregnancy, low doses of medications may be given if necessary. Although the degree of excitement by the father, the mother's ability to provide help, and the client's financial situation may or may not be a concern. The priority in this situation is the safety of the fetus and risks associated with the need for antipsychotic therapy. A client has been in the critical care unit for 3 days following a severe myocardial infarction. Although he is medically stable, he has begun to have fluctuating episodes of consciousness, illogical thinking, and anxiety. He is picking at the air to catch these baby angels fly around my head. While waiting for medical and psychiatric consults, the nurse must intervene with the client's needs. Which of the following needs have the highest priority? Select all that apply. 1. Decreasing as much foreign stimuli as possible. 2. Avoiding challenging the client's perceptions about baby angels. 3. Orienting the client about his medical condition. 4. Gently presenting reality as needed. 5. Calling the client's family to report his onset of dementia. The correct answers are 1, 2, and 4. The abnormal stimuli of the critical care unit can aggravate the symptoms of delirium. Arguing with hallucinations is inappropriate. When a client has illogical thinking, gently presenting reality is appropriate. Dementia is not the likely cause of the client's symptoms. The client is experiencing delirium, not dementia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse interprets which of the following as an early sign of acute respiratory distress syndrome in a client at risk? 1. Elevated carbon dioxide level. 2. Hypoxia not responsive to oxygen therapy. 3. Metabolic acidosis. 4. Severe unexplained electrolyte imbalance. The correct answer is 2. A hallmark of early ARDS is refractory hypoxemia. The client's PaO2 level continues to fall, despite higher concentrations of administered oxygen. Elevated carbon dioxide and metabolic acidosis occur late in the disorder. Severe electrolyte imbalances are not indicators of ARDS. A client has the following arterial blood gas values: pH 7.52, PaO2 50, PaCO2 28, HCO3 24. The nurse determines that which of the following is a possible cause for these findings? 1. Chronic obstructive pulmonary disease. 2. Diabetic ketoacidosis with Kussmaul's respirations. 3. Myocardial infarction. 4. Pulmonary embolus. The correct answer is 4. PaCO2 of 28 and PaO2 of 50 are both abnormal. The PaO2 of 50 signifies acute respiratory failure. In evaluating possible causes for this disorder, the nurse should consider conditions that lead to hypoxia and hyperventilation, such as pulmonary embolus. COPD is typically associated with respiratory acidosis and elevated PaCO2. The client with diabetic ketoacidosis most often has metabolic acidosis. A myocardial infarction does not often cause an acid-base imbalance because the primary problem is cardiac in origin. Which of the following complications is associated with mechanical ventilation? 1. Gastrointestinal hemorrhage. 2. Immunosuppression. 3. Increased cardiac output. 4. Pulmonary emboli. The correct answer is 1. Gastrointestinal hemorrhage occurs in about 25% of clients receiving prolonged mechanical ventilation because of the development of stress ulcers. Clients who are receiving steroid therapy and those with a previous history of ulcers are most likely to be at risk. Other possible complications include incorrect ventilation, oxygen toxicity, fluid imbalance, decreased cardiac output, pneumothorax infection, and atelectasis. A client has developed a hospital-acquired pneumonia. When preparing to administer cephalexin 500 milligrams, the nurse notices that the pharmacy sent cefazolin. What should the nurse do? Select all that apply. 1. Administer the cefazolin. 2. Verify the medication prescription as written by the physician. 3. Contact the pharmacy and speak to a pharmacist. 4. Request that cephalexin be sent promptly. 5. Return the cefazolin to the pharmacy. The correct answers are 2, 3, 4, and 5. One of the rights of drug administration is right medication. Cefazolin was not the medication prescribed. The pharmacist is a professional resource and serves as a check to ensure that clients receive the right medication. Returning unwanted medications to the pharmacy will decrease the opportunity for a medication error by the nurse who follows the current nurse. While making rounds, the nurse finds a client with COPD sitting in a wheelchair, slumped over a lunch tray. After determining the client is unresponsive and calling for help, the nurse's first action should be to 1. Push the emergency response button. 2. Call the rapid response team. 3. Open the client's airway. 4. Call for a defibrillator. The correct answer is 3. The nurse has already called for help and established unresponsiveness, so the first action is to open the client's airway. Opening the airway may result in spontaneous breathing and will help the nurse determine whether or not further intervention is required. Pushing the code blue button may not be the appropriate action if the client is breathing and becomes responsive once the airway is open. A quick assessment upon opening the client's airway will help the nurse to determine if the rapid response team is needed. Calling for a defibrillator may not be necessary nor the appropriate action once the client's airway has been opened. The parents report that their 1-day-old is drooling and having choking episodes with excessive amounts of mucus and color changes, especially during feedings. The nurse should contact the primary care provider to further assess the baby and request a prescription for 1. A lactation consultation. 2. A blood gas. 3. An X-ray with orogastric catheter placement. 4. A serum blood glucose. The correct answer is 3. The drooling and excessive mucus production is highly suggestive of a tracheoesophageal fistula. The initial diagnosis is made when an orogastric catheter cannot be passed to the stomach. A lactation consult would be warranted only after determining feedings were safe to continue. While cyanosis can be a sign of sepsis and hypoglycemia, the cyanosis is most likely related to the excessive secretions and airway patency. A blood gas may be needed, but only after ruling out a TEF. After surgery to repair a tracheoesophageal fistula, an infant receives gastrostomy tube feedings. After feeding the infant by this method, the nurse cradles and rocks the infant for about 15 minutes, primarily to help accomplish which of the following? 1. Promote intestinal peristalsis. 2. Prevent regurgitation of formula. 3. Relieve pressure on the surgical site. 4. Associate eating with a pleasurable experience. The correct answer is 4. The nurse can help meet the psychological needs of an infant being fed through a gastrostomy tube by rocking the infant after feeding. The infant soon learns to associate eating with a pleasurable experience and learns to trust the caregiver. Rocking the infant will not promote peristalsis or prevent regurgitation. Holding the baby will not relieve pressure on the surgical site. However, holding the child right after feeding promotes comfort and pleasure. When the infant returns to the unit after imperforate anus repair, the nurse should place the infant in which of the following positions? 1. On the abdomen with legs pulled up on the body. 2. On the back with legs extended straight out. 3. Lying on the side with the hips elevated. 4. Lying on the back in a position of comfort. The correct answer is 3. After surgical repair for an imperforate anus, The infant should be positioned either supine with the legs suspended at a 90-degree angle or on either side with the hips elevated to prevent pressure on the perineum. A neonate who is placed on the abdomen pulls the legs up under the body, which puts tension on the perineum, as does positioning the neonate on the back with the legs extended straight out. After teaching the mother of an infant with pyloric stenosis about the disease, which of the following is stated by the mother as a cause, indicates effective teaching? 1. An enlarged muscle below the stomach sphincter. 2. A telescoping of the large bowel into the smaller bowel. 3. The result of giving the baby more formula than is necessary. 4. The result of my baby taking the formula too quickly. The correct answer is 1. Pyloric stenosis involves hypertrophy of the pylorus muscle distal to the stomach and obstruction of the gastric outlet, resulting in vomiting, metabolic acidosis, and dehydration. Telescoping of the bowel is called intussusception. Overfeeding, feeding too quickly, or underfeeding is not associated with pyloric stenosis. Which of the following behaviors exhibited by the parents of an infant with pyloric stenosis should the nurse correctly interpret as a positive indication of parental coping? 1. Telling the nurse that they have to get away for a while. 2. Discussing the infant's care realistically. 3. Repeatedly asking if their child is normal. 4. Exhibiting fear that they will disturb the infant. The correct answer is 2. The parent's ability to verbalize the infant's care realistically indicates that they are working through their fears and concerns. This behavior demonstrates an understanding of the infant's condition and needs. Without further data, the fact that the parents have to get away could be interpreted as ineffective coping, possibly suggesting that they are unable to handle the situation. Continuing to ask about the child's general condition even after answers have been given does not suggest effective coping. The parents are demonstrating that they are unsure of themselves as parents or are hoping for positive information. Exhibiting fear that they will disturb the infant does not suggest effective coping. This behavior indicates that they are uncertain or lack knowledge about infants. A 38-year-old client at about 14 weeks gestation is admitted to the hospital with a diagnosis of complete hydatidiform mole. Soon after admission, the nurse would assess the client for signs and symptoms of which of the following? 1. Pregnancy-induced hypertension. 2. Gestational diabetes. 3. Hypothyroidism. 4. Polycythemia. The correct answer is 1. Hydatidiform mole is suspected when the following are present: pregnancy-induced hypertension before the 24th week of gestation, brownish or prune-colored vaginal bleeding, anemia, absence of fetal heart tones, passage of hydropic vessels, uterine enlargement greater than expected for gestational age, and increased human chorionic gonadotropin levels. Gestational diabetes is related to an increased risk of preeclampsia and urinary tract infections, but it is not associated with hydatidiform mole. Hypothyroidism, not hypothyroidism, occurs occasionally with hydatidiform mole. If it does occur, it can be a serious complication, possibly life-threatening to the mother and fetus from cardiac problems. Polycythemia is not associated with hydatidiform mole. Rather, anemia from blood loss is associated with molar pregnancies. The primary healthcare provider has prescribed prostaglandin gel to be administered vaginally to a newly admitted prima gravida client. Which of the following indicate that the client has had a therapeutic response to medication? 1. Resting period of 2 minutes between contractions. 2. Normal patellar and elbow reflexes for the past 2 hours. 3. Softening of the cervix and beginning of effacement. 4. Leaking of clear amniotic fluid in small amounts. The correct answer is 3. Prostaglandin gel may be used for cervical ripening before the induction of labor with oxytocin. It is usually administered by catheter or suppository or by vaginal insertion. 2 to 3 doses are usually needed to begin the softening process. Common adverse effects include nausea, vomiting, fever, and diarrhea. Continuous fetal heart rate monitoring and close monitoring of maternal vital signs are necessary to detect subtle changes or adverse effects. Prostaglandin gel usually does not initiate contractions. Therefore, the rest period between contractions will be greater than 2 minutes. There is no need to assess reflexes based on prostaglandin use. Leaking of amniotic fluid is not caused by the use of this gel. What is the most appropriate method to use when drawing blood from a child with hemophilia? 1. Use finger punctures for lab draws. 2. Prepare to administer platelets. 3. Apply heat to the extremity before venipunctures. 4. Schedule all labs to be drawn at one time. The correct answer is 4. Coordinating labs to minimize sticks reduces trauma and the risk of bleeding. Finger sticks in general are more painful and associated with more bleeding than venipunctures. In hemophilia, platelets are typically normal. Heat would increase vasodilation and increase bleeding. A woman who is Rh negative has given birth to an Rh positive infant. The nurse explains to the client that she will receive ROGAM. The nurse determines that the client understands the purpose of ROGAM when she states, 1. ROGAM will protect my next baby if it is Rh negative. 2. ROGAM will prevent antibody formation in my blood. 3. ROGAM will be given to prevent German measles. 4. ROGAM will be used to prevent bleeding in my newborn. The correct answer is 2. ROGAM is given to new mothers who are Rh negative and not previously sensitized and who have given birth to an Rh positive infant. ROGAM must be given within 72 hours of the birth of the infant because antibody formation begins at that time. The vaccine is used only when a mother has born an Rh positive infant, not an Rh negative infant. ROGAM does not prevent German measles and is not given to a newborn. A prima gravida client admitted to the labor area in early labor tells a nurse that her brother was born with cystic fibrosis, and she wonders if her baby will also have the disease. The nurse can tell the client that cystic fibrosis is 1. X-linked recessive, and the disease will only occur if the baby is a boy. 2. X-linked dominant, and there is no likelihood of the baby having cystic fibrosis. 3. Autosomal recessive, and that unless the baby's father has the gene, the baby will not have the disease. 4. Autosomal dominant, and there is a 50% chance of the baby having the disease. The correct answer is 3. Cystic fibrosis and other inborn errors of metabolism are inherited as autosomal recessive traits. Such diseases do not occur unless there are 2 genes for the disease present. If one of the parents does not have the gene, the child will not have the disease. X-linked recessive genes can result in hemophilia A or colorblindness. X-linked recessive genes are present only on the X chromosome and are typically manifested in the male child. X-linked dominant genes, which are located on and transmitted only by the female sex chromosome, can result in hypophosphatemia, an inborn error of metabolism marked by abnormally low serum alkaline phosphatase activity and excretion of phosphorethanolamine in the urine. This disorder is manifested as rickets in infants and children. Autosomal dominant gene disorders can result in muscular dystrophy, Marfan syndrome, and osteogenesis imperfecta. Typically, a dominant gene for the disease trait is present along with a corresponding healthy recessive gene. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The primary healthcare provider prescribes betamethasone for a 34-year-old multigravida client at 32 weeks gestation who is experiencing preterm labor. Previously, the client has experienced 1 infant death due to preterm birth at 28 weeks gestation. The nurse explains that this drug is given for which of the following reasons: 1. To enhance fetal lung maturity. 2. To counter the effects of tocolytic therapy. 3. To treat chorioamnionitis. 4. To decrease neonatal production of surfactant. The correct answer is 1. Betamethasone therapy is indicated when the fetal lungs are immature. The fetus must be between 28 and 34 weeks gestation, and birth must be delayed for 24 to 48 hours for the drug to achieve a therapeutic effect. Antibiotics would be used to treat chorioamnionitis. Betamethasone is not an antagonist for tocolytic therapy. It increases, not decreases, the production of neonatal surfactant. The client with an Axis 1 diagnosis of schizophrenia, undifferentiated type, is acutely psychotic and exhibits religious delusions and hallucinations, loose associations, and concrete thinking. When the nurse offers a client her medication, the client states, "I don't need that. God will heal me." The nurse should respond to the client by saying, 1. God helps those who help themselves. 2. God wants you to take your medicine. 3. God is important in your life, but the medicine will help you too. 4. This medicine will help clear your thoughts and decrease anxiety. The correct answer is 3. Stating that God is important in the client's life recognizes the client's cognitive and perceptual disturbances and level of anxiety, and acknowledges the client's message in a respectful and neutral manner, while adding that the medicine also will help, clearly and directly states the need for medication. Stating, God helps those who help themselves challenges the client. Stating, God wants you to take your medicine is deceitful. Stating, medicine will help clear your thinking and decrease anxiety, would be helpful to the client later when she is less acutely psychotic and anxious. The cervix of a prima gravida client in active labor who received epidural anesthesia 4 hours ago is now completely dilated, and the client is ready to begin pushing. Before the client begins to push, the nurse should assess 1. Fetal heart rate variability. 2. Cervical dilation again. 3. Status of membranes. 4. Bladder status. The correct answer is 4. The bladder status should be monitored throughout the labor process, but especially before the client begins pushing. A full bladder can impede the progress of labor and slow fetal descent because she has had an epidural anesthetic. It is most likely that the client is receiving intravenous fluids, contributing to a full bladder. The client also does not feel the urge to void because of the anesthetic. Although it is important to monitor membrane status and fetal heart rate variability throughout labor, this does not affect the client's ability to push. There is no need to recheck cervical dilation because increasing the frequency of examinations can increase the client's risk for infection. Which of the following statements about a fetal biophysical profile would be incorporated into the teaching plan for a prima gravida client with insulin-dependent diabetes? 1. It determines fetal lung maturity. 2. It is non-invasive using real-time ultrasound. 3. It will correlate with the newborn's APGAR score. 4. It requires the client to have an empty bladder. The correct answer is 2. The fetal biophysical profile, a non-invasive test using real-time ultrasound, assesses 5 parameters: fetal heart rate reactivity, fetal breathing movements, gross fetal body movements, fetal tone, and amniotic fluid volume. Fetal heart rate reactivity is determined by a non-stress test. The other 4 parameters are determined by ultrasound scanning. The results are available as soon as the test is completed and interpreted. The lecithin-sphingomyelin ratio is used to determine fetal lung maturity. Although the fetal biophysical profile is useful in predicting which fetuses may be at greater risk for compromise, there is no correlation with the newborn's APGAR score. The biophysical score is sometimes referred to as the fetal APGAR score. A score of 8 to 10 indicates fetal well-being. Use of an ultrasound requires the mother to have a full bladder. What is the most appropriate long-term goal for an outpatient client with chronic undifferentiated schizophrenia who has been withdrawn from friends and family for 3 weeks? 1. Calling the client's mother once a day. 2. Attending day therapy 3 times a week. 3. Allowing 2 friends a visit every day. 4. Remaining out of bed for 10 hours a day. The correct answer is 2. Attending day therapy 3 times per week is a long-term goal that will show the most progress in overcoming withdrawal. The client's calling his mother is a first step in getting out of severe withdrawal. Allowing 2 friends to visit every day would be appropriate if the client is successful with calling his mother once a day. Insufficient information is presented in the scenario to indicate that excessive sleep is a problem. The most common reason given by mentally ill clients for noncompliance with medications is their uncomfortable adverse effects. When teaching the families, what needs should the nurse identify as the greatest? 1. Alternative ways to manage the adverse effects. 2. Home visits to set up a week's supply of medications. 3. Family monitoring of the administration of medication. 4. Outpatient monitoring of medication compliance. The correct answer is 1. Ways to decrease or manage adverse effects without additional medications is crucial. Although home visits, family monitoring, and outpatient monitoring may help, if the adverse effects are not controlled, the client is less likely to take the drug, which would interfere with its effectiveness. While caring for a prima gravida client with Class 2 heart disease at 28 weeks gestation, the nurse would instruct the client to contact her primary health care provider immediately if the client experiences which are the following: 1. Mild ankle edema. 2. Emotional stress on the job. 3. Weight gain of 1 pound in 1 week. 4. Increased dyspnea at rest. The correct answer is 4. Increased dyspnea at rest must be reported immediately because it may be indicative of increasing congestive heart failure. Mild ankle edema in the 3rd trimester is a common finding. However, generalized or pitting edema, suggesting increasing congestive heart failure, must be reported immediately. Emotional stress on the job increases cardiac demand. However, it needs to be reported only if the client experiences symptoms, such as palpitations or irregular heart rate, indicating heart failure related to the increased stress. Weight gain of 1 pound per week is a normal finding during the 3rd trimester. Which of the following is essential when caring for a client who is experiencing delirium? 1. Controlling behavioral symptoms with low-dose psychotropics. 2. Identifying the underlying cause of condition or illness. 3. Manipulating the environment to increase orientation. 4. Decreasing or discontinuing all previously prescribed medications. The correct answer is 2. The most critical aspect when caring for the client with delirium is to institute measures to correct the underlying cause of condition or illness. Controlling behavioral symptoms with low-dose psychotropics, manipulating the environment, and decreasing or discontinuing all medications may be dangerous to the client's health. The nurse reviews a client's electrolyte results and notes that the potassium level is 5.4 milliequivalent per liter, which should the nurse observe for on the cardiac monitor as a result of this laboratory value. 1. ST elevation. 2. Peak P waves. 3. Prominent U waves. 4. Narrow peak T waves. The correct answer is 4. A serum potassium level of 5.4 milliequivalent per liter is indicative of hyperkalemia. Cardiac changes include a wide, flat P wave, a prolonged PR interval, a widened QRS complex, and narrow peak T waves. A nurse is teaching the families of clients with chronic mental illnesses about causes of relapse and rehospitalization. What should the nurse include as the primary cause? 1. Loss of family support. 2. Non-compliance with medications. 3. Sudden changes in medications. 4. Non-attendance at treatment programs. The correct answer is 2. Non-compliance with medications is documented as the primary cause of relapse. Although loss of family support, sudden changes in medications, and non-attendance at treatment programs may contribute to relapse, these factors are not as significant as medication non-compliance as causes of relapse. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.